we bring you our community's response to COVID-19. Our speakers today will be Mr. Tracy Doty, President and Chief Operating Officer, Huntsville Hospital, Dr. Karen Landers, Madison County Health Officer, Alabama Department of Public Health. At this point, I'll give the current numbers. In the state of Alabama, there are 815,989 cases of COVID. In Madison County, 52,114, having resulted in 694 deaths. Current positivity rate for Madison County is at 9.1%. At this point, we'll go to our first speaker, Mr. Tracy Doty, Huntsville Hospital.
Thank you, sir. I'd like to start out by, first of all, thanking our frontline healthcare workers for all the work you've done over the last months and over the last year. We appreciate your efforts, your sacrifices, the time you spend away from your families. So thank you from all of us here at the hospital, from the city, and from our Board of Trustees. We really appreciate all the work you've done. Overall, today's good news, I would like to say. If you look at our inpatient positives, we have 69 in Madison County, 12 in the ICU, and 8 on the ventilator. This is about a half of what it was a month ago, so that's very good news. Last week at this time, there were 95 patients in the hospital, so 95 last week, 69 today, and that 69 number represents about half of what it was a month ago. We're thrilled to see these numbers come down, and we're prayerful and hopeful they'll continue to come down. Health system as a whole, there are another 59 patients outside of Madison County, 21 in the ICU and 17 on the ventilator. Those numbers came down dramatically as well in our system, about half of what they were a month ago. In Crestwood, they currently have 8 inpatients, 1 in the ICU and 1 on the ventilator. So their numbers are dropping as well. So all those are good signs that things are getting better in Madison County and North Alabama, and we're glad about that. Still today, the number of patients in the hospital are vastly unvaccinated. That number's ranged anywhere between 85 and 90%. Currently today is a little over 70%, but that number goes day to day. So we still encourage people to get vaccinated. Studies show that you're 10 times more likely to be in the hospital if you're unvaccinated and or die. You're 10 times more likely to be in the hospital if you're unvaccinated and or die for those people who are not vaccinated. The average age in the hospital currently is 65, and there's a pretty even split between male and female. We get that question quite a bit about our gender. In Madison County, we have 4 children in the hospital and 2 OB patients, and we've had 6 deaths since Monday in Madison County. Our positivity rate is less than 10%, which is a very good number for us. That means that less than 1 out of 10 patients who are getting treated or tested in our labs and emergency room are coming back positive. So that's a very good sign. We are starting to see some flu. So I'll stop now and suggest people start getting their flu shot if they haven't. This is flu season, so please get your flu shot. COVID has impacted the hospital over the last couple weeks and months. We've curtailed our elective surgery schedules. That's still happening today. We're bringing some of those surgeries back online as we go forward, and we hope to be back to normal here pretty soon. Patients are anxiously awaiting, and so are doctors and staff. So we're trying our best to get back to normal as fast and as safe as possible. Our fever and flu clinic is still operational on 120 Governor's Drive. I will encourage you, if you're feeling sick, not feeling well, had a high-risk exposure, any reason to think you have COVID-19 and or the flu, please go to 120 Governor's Drive. It's paramount that you get tested early and treated early. There's monoclonal therapies to treat you early that's had wonderful outcomes, so please go early. We continue vaccinations at John Hunt Park. All the studies out there show that vaccines are the way for us to get back to normal. I will say we are social creatures by nature, humans are. We like to be out and about and at ball games and at the park and other things. I definitely do. My kids play sports and ball, and I'm at the ball fields on Friday nights, all those things. So vaccines are important. So please get your vaccine if you haven't. We're doing about 600 boosters a day at John Hunt Park. Most of our first and second doses are kind of waning off, but if you still need a first dose or to get your second dose of your series completed, please let us know and we'll get you scheduled. We're out today doing vaccines in the community. We have 4 or 5 events set up over the next couple weeks, so we're excited about it. You'll start hearing information about children getting vaccines. We'll await the state and federal government to let us know when and how and the dosing, but sometime over the next month, maybe tomorrow, who knows, but sometime over the next couple weeks, we'll hear more about children and vaccines, and we'll definitely do those at John Hunt Park as well. We're geared up, ready, and excited to do so. Even got some teddy bears to give out to the little ones that come by and get their vaccine, so we're ready to do that and glad about doing it. Mask. We get questions about masking. Is it still important? And we'll say yes. The science says it's important to wear your mask, even if you're vaccinated, especially indoors when you're around people who you don't know their status. When you're in large crowds, even outdoors, if you can, wear your mask. So just be smart about it. Be smart about the spread. Do those things we learned over the last year that will help us continue to move forward. These are good things that we're hearing today as far as our numbers going down, but we want to continue to remind people to get their vaccine, get their flu shot. If you are feeling sick, please go and seek medical treatment. Thank you.
Thank you, Tracy. Now we'll go to Dr. Karen Landers from the Alabama Department of Public Health.
I would like to thank the City of Huntsville, the City of Madison, and Madison County for continuing to invite me to these updates and for the participation that we continue to have with our local hospitals as well as our EMA. In my career, this is really the event that I trained for, something that I've spent my whole career in public health, having an interest in emerging infectious diseases and hoped it would never happen. But it did happen. We have responded in the best manner that we can with the science that we have and the resources that are available. And we continue in the Alabama Department of Public Health to put the health and well-being of our citizenry above all and being paramount to get the state of Alabama through this pandemic. And we could not do this as a Department of Public Health without partnerships at the local, regional, and state level. So again, thank you, Tracy, and thank you, Jeff, and the other persons, Dr. Hudson, and others who have continued to serve on this committee and with this group. I would like to deliver as much good news as possible today, also with a word of caution. Many of you have heard me speak before. You know I am a cautious physician. I think being cautious and being a physician are really good characteristics to have together. And again, I would like to start off by speaking a little bit about vaccine and following up on what Tracy said. As we all know, a few months ago, the Advisory Committee on Immunization Practices advised that certain people should receive a third dose of vaccine. A third dose is different from a booster from the standpoint of who is eligible for third doses. And again, third dose is primarily centered around persons who had immunosuppressive conditions. Now, a few weeks ago, booster doses were approved for the Pfizer product. And again, of course, with the Pfizer authorization, this was for people who had originally taken that product. The dose of the product was actually the same dose, and the booster was recommended in about 6 months, about 6 months after the primary series had been completed. So again, Pfizer has full authorization under EUA for the third dose. I'm sorry, I talk a lot. In speaking of what's going to happen with Moderna and with J&J, I think we have to remember that the approval is a process. The first situation that happens is that the vaccine-related biological products advisory committee meets. They met last Friday. They vote, they provide recommendations to FDA. FDA then grants authorization depending on the information that has been given to them by VRBOC, and then provides that information to the Advisory Committee on Immunization Practices. Again, ACIP is meeting today and tomorrow. I can tell you that today they're not discussing COVID vaccine. They're discussing other vaccines. They will be meeting and talking about COVID vaccines tomorrow. And then, of course, that information goes to the CDC for the final recommendations. So we're at the point right now that we're waiting on language related to booster doses. We're waiting on guidance. We're waiting on language. You know, what's going to happen with Moderna? Well, again, the recommendation for approval was for the Moderna booster to be half the initial dose of Moderna vaccine. So again, Moderna has a little bit different dosage from the Pfizer mRNA vaccine. And that, again, same process in terms of 6 months after completing the primary series. Johnson & Johnson, again, which has been our single-dose vaccine, but there is some discussion about Johnson & Johnson becoming a 2-dose rather than a booster, but nevertheless, we will await what ACIP says. Johnson & Johnson would be the same dose for the booster. So again, slightly different with Moderna, but this is all based upon what we have received from the Vaccine-Related Biological Products Advisory Committee, and again, we will await what the ACIP advises and the CDC. So we can't act on any of this, and I know we've had a lot of phone calls about what can we do. We received Moderna, we received Johnson & Johnson. We're waiting on language, we're waiting on guidance. I do expect that certainly by the end of this week. Now, I do want to mention mix and match. As a physician, as a scientist, I have been following the subject of mix and match. I've been very interested in this for a couple of reasons. Number one, I really wanted to look at how the immunity played out after mix and match, and I also wanted to look at it in terms of a resource situation where we do have vaccine throughout the state of Alabama, but in some instances we might have more of one product than the other, and certainly we want to be able to follow the science on this and do what is appropriate in terms of the guidance. So you've heard a lot about mix and match, and I expect some guidance on that. I know people said, well, FDA has approved it, and I'm saying I don't have language on it yet, I don't have guidance on it yet, so I can't do it. But I'm particularly interested in that, and I hope that we'll have more information in the next couple of days. And again, I am also personally interested in this because I have family members that were able to receive different products. Again, they received the product that was available to them, and so they're also interested in mix and match and what they should do related to that. Now, Tracy mentioned pediatric doses. I can give you a little bit more information in terms of a timeline for the 5 to 11. VRBOC is meeting on October the 26th. So we expect that once they meet and provide recommendations that, again, we will move forward in the same process, stepwise process that we have. ACIP is scheduled to meet the 1st of November, the first week of November. So again, we will not be administering vaccine until after that time. In Alabama, we're already planning for the 5 to 11. I'm, again, especially interested in this as a pediatrician, and we are speaking with our pediatricians, actually planning to have a meeting with our pediatricians statewide by Zoom once we have further information on this, again, next week and then after. The pediatric administration of COVID-19 vaccine presents several issues that we need to ensure that we have education out there about this. And again, you know, first of all, keeping in mind we're talking about the Pfizer product. The product is going to look different in terms of the presentation, actually going to have a different color of the bottle. The dosage will be different. It will be a 10 microgram dosage. The diluent will be different from what is currently being used with the EUA product. And of course, Pfizer has full approval for the 18 and above age group with its product Comirnaty. Sorry, that's a little bit hard to say. But again, the new product that is full approval actually doesn't have a diluent with it. So there's a lot of education in terms of using the product, and there's also education in terms of handling of the product. Again, the full EUA product, and now when the pediatric product, again, is approved, I believe it will be, there's a different recommendation in terms of storage, and there's also a different recommendation in terms of the administration. With the storage, I think the biggest challenge we're going to face is that with the product, it's either going to need to be an ultra cold, frozen, or refrigerated for 10 weeks in a vaccine refrigerator. So again, it's very, very important with the handling of the product, again, that from the time that we receive the shipment until the product is administered to the patient, that we follow all of the guidelines related to this. So we're doing a lot of education on that particular topic, and I believe that it will be an exciting couple of weeks here, but also a couple of weeks that will require our ongoing discussion with our providers in order to ensure that we are ready to roll this out in the state of Alabama. I do want to back up for a moment and really dovetail off of what Tracy just said about vaccines. We're not going to boost our way out of a pandemic, okay? And while boosters are being recommended, we still need people to take the primary series. It is so important. I mean, really, I'm very glad that over half of Alabamians now have had at least one dose of COVID-19 vaccine. But still, if you look at full vaccination as still defined with the 2-dose series of the mRNA and a single dose of J&J and then the intervals of 2 weeks after that, we still are in the 40% in some counties. We're lower than that in other counties, but Madison County is actually one of our highest counties as far as full vaccination. But we're not going to boost our way out of the pandemic. We need people to get vaccinated. And it's extremely important to also remind people, I've had a lot of discussion with people, ongoing discussion about natural immunity. Well, I'm just going to take my chances. If I get COVID, I'll see how my immune system responds, and I'll be good. Well, there's a lot of literature about natural immunity, and some of the information about natural immunity is concerning, and actually something that came out very early in this pandemic, where some people who had COVID and they had basically an asymptomatic case or a mild case did not have very much immunity as measured by neutralizing antibodies. Now, is that the only factor here in COVID immunity? Well, frankly, we don't know. We have information on that, but we also don't have as much information on what the T cells are doing as we would like to be able to do. But nevertheless, we are concerned about people relying on their natural immunity because persons who have had very severe COVID, may have more immunity. But what did it take for them to get there? And also the risk with COVID does not respect your age. It does not respect your health status. We've had younger people to die. We've had previously healthy people to die. So again, taking your chance with COVID is not a very good idea. Now, all that being said, I don't want to completely discount natural immunity because there is some more recent information that indicates that persons who have had COVID should be vaccinated after they've had COVID, and they actually appear to have quite good immune response as we are currently measuring it. So I think the data is encouraging there. I think the data is good, but again, still don't try to get COVID to get your immunity. Get vaccinated instead. It's safer to get vaccinated than it is to run your risk with this virus. And I'd really like to wrap up my remarks by talking a little bit about prevention. I mean, I think everyone is very, very tired of hearing the discussion of mitigation, and they're probably tired of hearing me say all of the information about mitigation. But my responsibility as a physician is to give medical advice, and that's what I am doing. I'm giving medical advice. I'm giving the advice that is based upon the best science that we have related to mitigation as well as vaccine. So, questions come up all the time about, well, when can we stop mask? I really don't have people asking me about when we can stop hand washing and social distancing, but I have people asking me when we can stop mask. Mitigation is layered. We don't rely on any one mitigation. We rely on the 3 layers of mitigation that we have spoken about, as well as ventilation and environmental cleaning that are certainly important, but really not as effective as our 3 mitigation standards put together, our layers put together, but we still want to encourage all of the mitigation to be followed. Now, that being said, again, what are the metrics? Well, we don't really have the best metrics for this. We have some metrics that are useful, And we have to look at the information that we have at the moment. We're still learning about COVID-19. The metrics we tend to look at in the Alabama Department of Public Health are community transmission, the percent positivity of tests statewide as well as at the county level. We also look at what's going on in terms of the vaccination in the community, what's the percent vaccination in the community, as well as the healthcare resources and any surveillance testing. So, as Jeff just mentioned, Madison County, for example, is 9% today as in terms of percent positivity. Well, that's still higher than the state average, which is actually 7.5%. So we're not there yet in Madison County just in terms of percent positivity. And overall, if we look at case transmission or cases per 100,000 statewide, we're still 65 persons per 100,000. So the reality of it is that we're still teetering between substantial and moderate. If you look at high, substantial, moderate, and low, we're still teetering between substantial and moderate. And if you have one of the metrics that is higher, then that is the community transmission level that you look at. So we're substantial in terms of cases, we're moderate in terms of our percent positivity, so that still puts us in the substantial range. All that being said, I say this to remind people that mitigation needs to continue until such time as we can get into lower levels of community transmission, lower rates of percent positivity, and higher levels of vaccination. And again, our healthcare system not being strained. Again, as I said, masks tend to be the point at which people get upset. We did a news release yesterday speaking to the issue of masks in schools. Why do we recommend that? Why do I, as a pediatrician, recommend that we continue to mask in schools? Again, we're talking about the indoor setting. We're talking about kids being close together in a congregate setting for a period of time. In some of our situations, we're not able to keep as much distancing, so again, we try to layer. The studies on this are extremely clear, and I get a lot of email, I get a lot of phone calls about people saying that masks don't work. So, I just decided today to bring 4 studies that show that masks do work. These actually were done, some of these were done in North Carolina, and actually North Carolina is a state that's very similar to Alabama in terms of population. And then I remind people of a very effective study, really the Bangladesh study. It's information that I had to read that. It was 94 pages long, so it's pretty significant information. Again, we as medical officers in the Alabama Department of Public Health take our jobs very seriously. I take my responsibility as a physician giving medical advice very, very seriously, and the medical advice that I provide in my updates with the Alabama Department of Public Health, as well as speaking to patients individually, is based upon the science. Masks work. We need to keep this layer in place until such time as we have lower levels of community transmission, lower levels of percent positivity, and our vaccination rates are going up. And I hope that people will continue to understand that this information is provided for the protection of our citizenry and for the protection of our children, the protection of their ability to be in the learning environment. I advise people, do not give COVID any more chances. COVID does not deserve any more chances. And when we are tempted to relax our mitigation, that's when COVID will sneak back in. We're in a good place now. We're getting better. But let's stay the course. Let's continue to follow the medical guidance so that we can get through this together and have a healthier and better state. Thank you very much.
Thank you, Dr. Landers, and thank you for watching today. Our next briefing will be next Wednesday, October 27th at noon. Until then, critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. Until then, stay safe, stay separate, and remember to sanitize. At this point, we'll take questions. As always, as you come to the mic, please identify yourself and who you're affiliated with, and we'll allow one question and a follow-up.
All right. Hey, guys. My name is Lauren Harkson. I'm with News 19. This is for Mr. Dowdy. What is the hospital employee vaccination rate right now at Huntsville Hospital, if you could talk about that?
The employee vaccination rate?
Yes, sir.
The last I looked at was last week. We're above 60% fully vaccinated.
Okay. And then my follow-up, do y'all plan at any point on making a vaccine mandate for those working at the hospital? And if so, do you think that would have any kind of impact on staffing?
There are no plans from us to make it mandatory. If the government makes it mandatory for hospitals or CMS does, we'll follow suit and follow the rules.
Okay. Thank you.
Nixon Norman, Fox 54. Hi, Dr. Landers. Hi. So my questions are for you, Dr. Landers. And speaking from a pediatrician and mother point of view, just keep in mind when I'm asking, many parents are upset with masking mandates in schools, and I'm sure many parents will be upset, when the vaccine comes out and it's kind of recommended. What would you say to those parents that are a little hesitant or are hesitant to get their children vaccinated when the time comes that is approved?
Nixon, thank you for that question. And again, I remind people, I have 2 children. They're in their 30s now. But again, we're always going to be mothers. It doesn't matter how old our children are. It's very, very important for people to follow the science on this particular topic. And again, keep in mind, as I said earlier, COVID likes to find a place. And right now in Alabama, overall, still about 19 or 20% of our cases are in kids 0 to 17 years of age. And that's much higher than last year. I've had a few people point out, well, we had virtual school last year. Well, yes, we did have some virtual school. But if we look back at our data, even in the summer, we're almost double what we were in pediatric cases. So keep in mind, COVID has found a place, and it's the pediatric population. And so what I tell parents is we want to keep our children safe. We want to keep our children out of the hospitals, out of the intensive care unit, and off the ventilator. And at one point during the peak for COVID-19, we had over 50 kids in the hospital, and at one time we had 9 kids on ventilators. So again, not a safe virus to be playing with. Now, all that being said, we also want to keep in mind that our children, first of all, need to be protected, but also the loved ones around our children. We don't want a grandparent or a parent, perhaps, that has an immunosuppressive condition or a low immunity for some other reason to contract COVID from their child or grandchild. So again, we have to look at it in context there. Also, I strongly recommend that parents speak to their pediatrician about this. And again, the Alabama chapter of the American Academy of Pediatrics, of which I am a member, and my colleague Dr. Wes Stubblefield is a past president and has recently joined us in the Alabama Department of Public Health. We are holding discussions with this group in Alabama in order, first of all, for them to be able to provide the information to parents and also to be ready to roll out this vaccine. So again, the vaccine is safe, the vaccine is effective, and the vaccine is going to be the way that we get ourselves out of this pandemic and get our children back to normal.
And actually, that leads me to my next one, which is a little more opinion-based, but a lot of kids have lived a very different life than we have because of this pandemic. So would more children getting vaccinated again when that time comes help provide them with some more consistency and like a sense of normalcy? And, once more kids get vaccinated, again, this is kind of hypothetical, could you see maybe those masking mandates kind of going away and the distancing in schools going away once more get vaccinated?
Well, I'll speak to the second issue first. We all want mitigation metrics to be a little clearer, but we're having to go with the information that we have at the moment. And yes, absolutely, I don't think anybody wants to continue to wear a mask. Even though I'm a doctor and I don't really mind it, would like to not have to wear a mask myself. And certainly we know that some of our schools are restricted in terms of their physical plant there. They just don't have that much space. So to speak to mitigation, absolutely, you know, that's our goal, to get back to normal. As a pediatrician, and again, Dr. Stubblefield and I have spoken quite a bit about this. We actually just did a video recently as pediatricians and expressing our concern about the impact that COVID has had on children and on children's mental health, on children's ability to be in classroom and to learn in classroom. And again, we know that some of our kids rely upon school for not only the education they receive, but also for food and for emotional support and social support that regrettably some of our children don't have due to disparities. So as pediatricians, we are extremely anxious to get our children back to a sense of normal. And we recognize that even when we get to a time where COVID becomes the 5th coronavirus that infects people periodically with respiratory diseases, it will take time for people to recover from the impact of COVID within their own families, within their children's circle. It's going to take time for us to get back. It's going to be a really, really very long recovery process, but we can start it sooner if we get this behind us. Thank you.
At this point, we'll end the press conference. Thank you for coming.